and they continue lengthening until they achieve the length desired.
Another important part of the daily routine is pin care. Here, Carolyn sterilizes and cleans the area in which the pins penetrate Kelly's skin. This does cause some discomfort, but her parents say overall Kelly is not in pain. Because she is still growing, Kelly will undergo another lengthening when she is 7 and again during her early teens. But the procedure is not just for children who are still growing. When Becky Lewis and her mother Sally first contacted Dr. Paley, he was concerned about Sally's age. She was 60 years old.
He had a team of doctors with him, and his first question to me was, "Why are you doing this? You're so old." And I said, "I have 40 more years, and I need a leg that touches the ground now."
Sally spent every day standing tiptoe on her shorter leg to balance a 5-inch length difference. Since childhood, Sally has refused to wear a prescribed shoe lift.
This was the lift that I would have to wear on my left foot in order to not have to compensate.
Despite Dr. Paley's concern about her bone's ability to calcify, Sally's leg lengthened all 5 inches in just 7 months. Becky, who by sheer chance was also born with a short limb, had the same procedure.
I mean, it's a scary proposition to go forward and do it, but I'm really glad I did it.
There's no pain to this operation, the actual operation. The stress comes when you're getting beyond 2 inches and you're trying to keep those muscles and nerves lengthening.
As bone lengthens, it forces the surrounding muscles and soft tissue to stretch with it. There is a potential for permanent damage, nerve paralysis, and even ruptured blood vessels. This is what many critics point to as a danger of the procedure and a reason why more surgeons don't do it.
That's why you have to have a very intensive physical therapy program. The soft tissues, if you ignore them, will cause complications that can be irreversible. And a lengthening that goes sour is worse than the condition was to begin with.
After seeing what's involved in limb lengthening, you might conclude that amputation would be simpler and therefore cheaper. But in fact, just the opposite is true. A lifetime of artificial limbs after amputation can cost as much as $1 million, whereas limb lengthening is much cheaper, about $75,000. For most of Dr. Paley's patients, the benefits are obvious. But for a special group, the procedure offers an even more profound impact. In what is considered an experimental and controversial move, Dr. Paley performs limb lengthening on dwarfs. 12-year-old Casey Graham was born a dwarf. He has already completed the lengthening of his lower legs and is now lengthening his arms. Casey says at first the device was hard to look at.
It looked a little bit harder than I thought it would be because there's obviously pins in your arms, and that's not natural.
From his original height of almost 3 feet 6 inches, Casey is now 3 1/4 inches taller. His goal is to be at least 5 feet as an adult.
When did you become aware of some of the practical problems of everyday living?
When everybody started getting to ride the bikes.
And you couldn't ride a bike?
Couldn't ride a bike without training wheels.
Casey's mother Andrea saw limb lengthening as an answer to a more serious problem. Casey's large head would cause him to lose his balance.
So the large head combined with the short limbs, he tends to fall, and when he falls, the head whips forward and he takes it on the head.
Casey, this is a tough question to ask a young man, but I'm going to ask you. What's most important to you about this, the way you're going to look or the way you're going to be able to function because of this?
The way I'm going to be able to function.
That's really what you think about mostly?
Yeah, because I don't care how I look. I just want to be able to do what everybody else can do.
What's wrong with being a dwarf? I'm perfectly happy with it.
Mary Carton is an active member and former president of the national organization Little People of America, or LPA. To be a member of LPA, you must be medically diagnosed as a dwarf. The organization strongly opposes limb lengthening for little people.
What I don't accept is that they're saying that so they could reach the light switch, so they can drive a car without having to have pedals or extension pedals. That's not good enough.
The people that we've talked to who've had the surgery would say, we choose to do this just so we can function better.
I think the operative word is not function. They want to blend in.
The Little People of America say, look, this kind of surgery is, in some hands at least, experimental. We shouldn't be doing this for something that's basically cosmetic.
Taking someone from 5'4" to 5'8" is cosmetic. Taking someone from 4 feet to 5 feet is not cosmetic. For work purposes and recreational purposes, being closer to the norm in height makes life easier.
One of the problems we had was he was too old to come in the ladies' room with me, but he couldn't get out of the men's room because he couldn't reach the doorknob or the handles.
Right.
He can do that now. He can reach light switches.
What would it take for LPA to officially bless this as an alternative for people who want it?
I say give us another 5 years of good hard data.
While it may take 5 years to satisfy the LPA, Dr. Paley has some results 10 years old. Jillian Muller is one of Dr. Paley's first patients to undergo lengthening for dwarfism. Jillian, at age 13, was only 3 feet 11.5 inches tall. Without lengthening, her adult height would have been just over 4 feet. But today, Jillian, at age 23, is proud to be over 5 feet tall.
Are you active?
Mm-hmm.
Doing
Run
any
every
sports?
day.
You run?
Every day.
How much do you run?
2 to 5 miles.
Come on.
Jillian hopes to start medical school soon. She is happy with her decision to have had lengthening done and has completed all the procedures. Little Kelly Lockett still has a few years of lengthening ahead of her, but her parents have no doubt that later in her life, she will understand and appreciate the choice they made for her.
I can never imagine talking to my daughter and saying to her, listen, there was a treatment out there, but we decided to amputate your foot. I could never do that.
There's good news about 2 of the young people in our story. Kelly Lockett had her lengthening device removed last May. Her parents tell us both legs are now the same length and her walk is absolutely normal. She'll continue to be monitored for more surgery as she grows. As for Casey Graham, the arm devices used to combat his dwarfism were also removed last spring. Next year, he may have surgery to lengthen his thighs.